Hi, everybody. I'm Wendy Murdoch, and this is Webinars with Wendy. I am continuing my series of webinars, and this one with Dr. Raquel Butler was scheduled quite a while ago. In fact, I can remember I was driving somewhere at that point when we were supposed to do it, and so there was a glitch. No worries. I am again not at home, which is my lovely hotel background here, but I'm so pleased to have her with us today to talk about scars. So welcome, Raquel. It's so nice to see you again.
Yes, thanks, Wendy. It's great to be back, and sorry it's been so long. Life's been pretty hectic, but getting back under control. So yeah, great to be back here.
Yep. All right. For those of you who might not know you, can you just do just a brief intro on your background?
Yeah. So yeah, I'm a vet. I qualified nearly 20 years ago as a vet. Worked in vet practice for a number of years, mixed practice overseas in the UK. And then I studied EMRT, so equine muscle release therapy. And I gradually went into my own practice, integrated veterinary therapeutics. Then I studied Graduate Diploma of Animal Biomechanical Medicine, which is osteopathy, chiropractic, and rehab for animals, obviously, and have studied many other therapies, kinesio taping, equitaping, laser, done some stuff with Jim Masterson, Kerry Ridgway, and I'm currently studying a grad dip in acupuncture as well. I also completed a Bachelor of Science last year, honours, and I've done some extra education around teaching too. So that's kind of in a nutshell. I have 4 horses, a baby who's 3, a rehab case who's 13, and 2 retired thoroughbreds. So they teach me a lot, and I'm constantly on the journey of learning.
It's awesome. And you're also a fan of Surefoot. I know that. I know you like the pads.
Yes. Yeah. I have a set of Surefoot pads, and I've been using them for a long time. Way before they were the new Surefoot pads.
I'm actually talking to Joe Watman about maybe, because I'm going to Africa in September for a safari, and I was like, maybe I'll just keep going and come to Australia.
Yeah, that'd be cool. That'd be great.
So, all right.
Can you just enable me to share my screen?
Oh, sorry. Yeah, absolutely. There you go. All set.
Oh, I lost that. Share that one. Okay, and this one here. Okay. So today I want to talk about scars, acute dimple or a deeper problem. It's an area that I'm very passionate about because I actually think it's actually a bit more complex than scars, but I actually think that it really affects biomechanics greatly and are often under-recognized in that implication. So I'm going to talk, hopefully my computer's going to behave, yeah. So today I'm going to talk about what is scar tissue, just kind of basically why do muscles tear? Not all scar tissue is related to muscle tears, but there can be. The clinical signs that we might see, diagnostics, common external scars, common internal scars, the effects on performance, treatment options, owner prevention and management, and there's a couple of cases in there as well. So here you can see a scar on the front of the shoulder, which is a really common area, especially from kicks. So what is scar tissue? It's a fibrous kind of dense connective tissue. So it's an alteration within the tissue depending where the damage has been caused. It is sorry, just moving my stuff around here. So normal tendons is a type 1 collagen, and type 3 collagens are in blood vessels, intestines, uterus, skin, but they have less tensile strength. So when we get kind of changes in collagen and a change to a type 3 collagen, then it's weaker. It becomes disorientated. The cross-linking is different. there's a different amino acid composition, and there's differences in the fibroblast cells. So overall, like, we lose that kind of general strength of the tissue. And it's been shown that in the linear elbow post-colic surgery, that there was mature collagen bundles at 60 days, but it wasn't checked for what type of collagen it was. But, you know, post-colic surgery is one type of, because of the, you know, the lack of kind of, I'll just stop, my connection's unstable, the lack of blood supply, and in general, scar tissue has less tensile strength. So what happens is that you get a weakened area, the horse is still moving, doing maybe its normal performance or running around the paddock, and then those areas become more prone to kind of micro tears and aggravation of that scar tissue. So within this picture up here, these images are from dissections in the Netherlands. So we've got a huge scar in the pectoral muscles. So the white area is a scar, and then the rest is obviously muscle tissue. And so you can see that that is quite deep, and from the external, you know, it might not have felt that deep. And then down the bottom, we see a lot of kind of, it's a different sort of scarring in the tendons, but especially horses that have done a lot of jumping or just a lot of performance, we generally see tendons that have like a buildup of scar tissue. And you can see the change in the vascularization through the tendon here too. So they should feel like beautiful and smooth, but they're feeling kind of a bit cord-like, a bit more kind of rigid. And so then they're losing some of those elastic properties. And we know that the fetlock really undergoes a lot of stress, especially jumping, horses working in sand a lot. So that's probably an area that isn't as commonly recognized unless they do a tendon. So the other thing that tears is fascia can tear, or the muscles can tear. And my thoroughbred, so here you can see in this image here, there's like a lump, like a protrusion, and that's where he's torn his fascia. There's always a reason for them tearing their fascia. So he has kind of chronic sacroiliac stifle issues. And so there's a reason that the fascia has become tight and then become more prone to tearing. One other potential cause of that is trauma. So obviously kicks are a big one. You know, I've treated a horse and then looked out the window watching them all happy. Then a horse goes up to the other horse and then he gets kicked in the chest like half an hour after a treatment. So, and he has quite a lot of scars in his chest, so he doesn't learn his lesson. It happens pretty often, especially in young horses or groups of horses, or just where you're feeding, you know, different feeding regimes. If there's tension or fascial tightness, as I just mentioned, so there might be some underlying problems, or perhaps there's a nutritional issue and the fascia is just not as healthy in its hydration, its collagen, and so it's more prone to tearing. But often when it gets tight, you know, it could be that it's protecting a joint that's not happy, and then the fascia tears, but meanwhile the underlying joint, such as the stifle or the hock, has been the problem. Skeletal dysfunction. So pivot, when I say pivot points, I mean like fulcrum points. So for example, the point of buttock, the tuba ishii, really common area for him. So horses especially that are doing like, well, some horses do it themselves in the paddock, like sliding stop into the gate, especially when it's muddy, or horses that are doing that as a job. So I see it a lot in like your camp drafting type, Western type of horse. But if the pelvis is restricted, then those areas are going to be put under even more strain when you ask them to go through that sort of movement. I've also got entheses sites there, which entheses sites are the site of either tendon, ligament, or muscle attachment to bone. and we want them to be really healthy, so the bones can move normally around the front, the cranial aspect, the front of the tubercocci, so also known as the point of hip. That's a really common area to get damage. We see a lot of that under dissection where those muscle fibers have been damaged. But ligament sites such as in the sacroiliac joint, the sacroiliac ligaments attaching across the top of the sacral tuberosity, the dorsal ligaments through there, really common areas to get tears. Sacrotuberous ligament as well, which is up next to the anus. Another aspect is compensatory tension, which I mentioned, in terms of there's something else going on. Unrecognized strain. So strain generally occurs at the origin of a muscle. And so you might have some strain occurring, say, in the origin of the flexor muscles in the elbow, but you don't notice it, and then the tendon tears. Underlying metabolic conditions. So PSSM, polysaccharide storage myopathy, or Cushing, they change they change muscle responses to exercise. They alter collagen health. They have a general effect on fascia as well. And in PSSM, those horses can be more prone to tying up, and tying up will set them up nicely for muscle tears, which is my next one, exertional rhabdomyolysis. So sometimes horses tie up pretty mildly and it's not that obvious, and then we can ask them to work. And my horse that I have, he has PSSM, and he used to tie up all the time, and he was a jumping horse. So when I met him, his hamstrings felt like a ropey mess. And over time, they're a lot better. He's actually losing his hamstring line now, but that's over years. And a lot of dietary management. Fatigue. So I think a lot of horses probably work in a state of fatigue because they don't have optimal balance, and whether that's hoof balance, saddle fit affecting that, rider balance, or their own physical ability to self-carriage. And so I think that the muscles are under fatigue quite a lot in horses, especially if those postural muscles are not well developed. And then over or under training. So under training and then taking them out on the weekend and doing a 5-day full-on clinic, or even 2 days, and overtraining where the muscles are not getting enough time to or the fascia, all of that, the bones are not getting enough time to recover physiologically, and so therefore they're kind of already in a weakened state in the next training session. And insufficient warm-up, especially if it's snowing.
Yeah.
So some clinical signs that we might see with either scars or muscle tears, it could just be a bit of poor performance. Perhaps they just don't stride out quite well. They could be lame. So I've had a few where they've torn, especially pec muscles, where they've come up acutely lame, and the vets haven't been able to isolate the cause of the lameness. But once you get in there, it's pretty obvious. They might just be have a push off kind of problem, or drifting in jumping. So they might have sore glutes. There could be, it could be acute. It depends if it's acute or chronic. So if it's acute, there might be heat. Sometimes at that stage, it can be difficult to discern the muscle damage. And then if it's more chronic, it might be a lot more like fibrosis, cold, have tension, and be more ropey. The other thing to check is it could be one or more muscles. So you always want to keep that in mind. And I think it's not an uncommon cause of lameness, and it's probably more common than we recognize. And I think that it's definitely a more common cause of biomechanical unsoundness, or what's the word, just biomechanical weakness, like they're just not quite striding out optimally. There's always a bit of an underlying gait issue that's not that obvious. So especially in the hind end, like I see canter issues with a lot of deep hamstring tears and scars. Now, I'm not sure how well this video will play.
Yeah, because even your slide is
video.
a bit pixely.
Okay.
But we'll see.
Oh,
there we go. Oh, now
Oh, wow. And especially with that.
Just turn that down. So is the slide okay now?
Yeah. Well, it was, and then it went back to pixely. I'm not sure what the difference is, why it does that. With the video,
Okay.
if it doesn't play well, sometimes if you just take the slide bar and drag it, we actually, oh yeah, no, we can see that.
Okay. So I'll just play it one more time.
Yeah.
You can see this horse is plaiting pretty badly.
Wow.
And she looks pretty ginger on her feet. So, the initial thought was check her feet, but with the plaiting, she had quite a substantial pec injury, and she was a big horse. And yeah, that was a long process to recovery for her due to that injury. So that was really acute, like that happened that day. So it was easy to kind of feel that. So in terms of diagnostics, palpation is a technique in the veterinary industry sometimes. They'll often be a bit worse on soft surfaces. Thermography could be utilized in the appropriate conditions, looking for heat or cold. Muscle enzymes there's a bit of controversy, I guess, around muscle enzymes damage. It used to be said that a tying up horse would have elevated muscle enzymes. However, maybe they have muscle that are elevated due to muscle tears, and it's going to depend on whether it's acute or chronic. So muscle enzymes are not necessarily an indicator of tying up, and I think we need to consider other things in there. Ultrasound is probably your best form of diagnostics, but you need an experienced ultrasonographer who understands their anatomy quite well. Scintigraphy can show up hot. So the radioactive isotope will be taken up in areas of inflammation, and so you might get an area of the muscle that comes up really hot. MRI would be great, but it's not always accessible. And then they're graded from 1 to 3. So what you can see on the left image, this was actually a 3-year-old standardbred colt from a paper, and it's an ultrasound of the gracilis muscle. And you can see we've got a lot of black areas in there. And so this was an acute issue, and that black area is where there's a tear and you've got like fluid accumulation. And then on the right image, tendinosus muscle, just below the tuber ischii. And the important thing to note is both of these are in young horses. So that's also a 3-year-old thoroughbred, which had a lameness of 1 month. And you can see that we've got white areas in there. So we've got fibrosis and scar tissue forming, which makes it, more difficult to treat at that stage. It's better off to get treating it at the acute stage, like straight away as soon as it happens. Once we've got some of the fibrosis, then we've got to break it down and try to fill in the gap with normal muscle tissue. So when we talk about the grades, grade 1 is difficult to determine on ultrasound, and it may require MRI. And then grade 3, there's a total of muscle function. But some people use a 1 to 3, some people use like a 1 to 5. It just depends there. Another area of discussion is the gelding scar. And It's
Raquel,
pretty
is there
common
any way
in
you can
geldings for this
get
to
the
be.
slide to be a little more clear? They're just, sometimes they're clearer than others. I don't know why. There we go. I don't know what you did.
I think it's just my internet.
Okay. But this is for this one, I
Yeah.
wanted it to be clear. The other one we can figure out what you're talking about.
Okay, so you can see it now.
Yep.
So yeah, gelding scars are an area that's obviously created a lot of discussion over the last probably few years. And it's definitely an area that causes problems. So there has been a paper that talks about neuromas occurring at the end where it's been cut, the spermatic cord's been cut, and they can be quite painful. But the other aspect of it is adhesions. Is adhesions within that area. So it doesn't always mean that there was, that the surgery was bad. Some horses will just be more prone to adhesions, but really the biggest aspect of it, I believe, is the exercise post gelding, and making sure they get adequate, like proper running around exercise to try to prevent those adhesions occurring, and an appropriate kind of aftercare. I think that's actually the key, rather than the necessarily the procedure itself. But it's a complex area, the inguinal canal ring, where the spermatic cord comes through, and then you can get adhesions externally, and they can affect internally. So it can have an effect on back pain, lumbosacral issues, hind end lameness, become behaviorally difficult due to the discomfort, and it can affect the iliopsoas connection in the lower back as well. So the other aspect of that is the effect on the fascial line. So I haven't really gone into those in this talk, but that's something to become familiar with, because the ventral fascial lines run through that area and run all the way up to the TMJ area of the horse. So we're having, a huge influence on the whole function of the horse through one area being scarred. The psoas, Ridgway talked a lot about psoas damage and scarring. Haven't seen it that much under dissection. However, I've seen really weak psoas muscles, and unhappiness, but fibrosis at the insertion femur. The diaphragm, so under dissection, we've seen a few diaphragms where the muscular portion definitely looks like it's had strains. It's not beautiful and smooth and regular. And when you think about the amount of strain in a racehorse, for example, or if they've had a fall, like a rotational fall, that could cause damage to the diaphragm. Or maybe even, just repetitive strain, and having a tight diaphragm, maybe from saddle feed or rider balance or something like that, causing kind of tension. So really important area to investigate in geldings with hind end issues. Common external scars in the forehand. So the brachiocephalicus, the neck muscle, the prophet's thumb. Now, sometimes the prophet's thumb is just a dent in the muscle and there's normal muscle fibers. However, under dissection, we see a lot where it's actually scar tissue. And so if it's scar tissue, it's affecting the function of that muscle. The pecs, I see a lot of scar tissue in the pectoral muscles, some from kicks, I think some from slips and slides, especially in the mud, and maybe especially in stallions that are mounting mares. The pecs are under a lot of strain all the time. Biceps brachii, not like we do see damage in the biceps brachii tendons then often it's a brachiocephalicus sitting over the top that gets damaged, but it can go deeper to the biceps brachii, and then the upper forelimb, and I've got some images of that. So here you can see this is a tear in the brachiocephalic. You can see that's an actual scar, that white area there. This is this horse. This image here is this horse's shoulder, and you can see all of this white kind of areas when we cut into those, or when they cut into those, were actually scars going into the muscles.
Can blankets
So
cause
all of
that
these
kind of scarring
areas.
in the shoulders?
I mean, I guess they could if they were, too tight and uncomfortable. They do cause wither issues, like flattening through the wither and the pain. So I guess, if it was poorly fitted and on for a long period of time, just the constant kind of irritation. Those muscles are pretty thin, some of them around there. So this was in a transverse pectoral, so it's a full thickness scar. There's no muscle in that area. And this one down here was a weird one. They were both in a horse that I dissected. And it was in the omohyoid muscle, which is very deep, like in that area. It was actually as it comes into the base of the neck, and it nearly had a full thickness scar across there. So that had nearly torn all the way across that muscle.
I'm not sure. Are we still on
at some point?
Are we still on the slide with
that
the horse's pecs on the right? The common.
No.
Okay, we're stuck on common external scars.
Okay, has it changed?
Not yet. Come on, Zoom.
Yeah, come on, internet.
Oh, there we go. Okay, that makes sense now.
I just exited out of. I'll try again. Okay. What is that better?
We've got one there. Yeah, your pictures are coming in now. There's two on the screen.
Okay.
There we go. There's all four.
The other two should come. Okay. So the top one here is in the transverse pectoral. There's a full thickness scar in there. And the bottom one is in the omohyoid. So that's the one I was just talking about. We do know that this horse had its forelimb kind of stuck briefly in between two bars and damaged the knee, and maybe it then when it pulled it back. It was on the same side as that injury, but not a common area to see that, and just not an area that you could have easily diagnosed externally, right, because of its position in there. Infraspinatus muscle, which sits along the scapula, the back of the scapular spine. So we see damage in there, which also can be associated with, and if you look at this picture on the left, the deltoid tendon. So often, because the deltoid tendon's really closely associated with the infraspinatus, we can affect both there. And that's an important thing, like sometimes it does affect more than one muscle. In terms of the hind end, so in a buttock, really common.
Our slide hasn't changed.
Area. That's okay. Oops. Oh, I'll just keep talking about it because just has the word, so it should catch up.
Yep.
So the hamstrings around the tuber ischii, on a buttock, the junction of the biceps femoris and the semitendinosus, so the line of the poverty line, that's a really common area to feel a lot of roughening, more fascial, but it still extends into the muscle.
Yeah, we still don't have
the fibrotic myopathy. Okay, let's try this. Is it better now?
Nope. We just have your background, your beautiful background with the nice color, purple colors, but no images on the slide. I see your
Just
pointer.
gotta catch up. I can see my pointer. Anything there now?
Nope. It's gonna wait till you go out of the slideshow to come back in. You know that, right? Yeah, we still don't have anything.
Yeah. But everything I already tried going out and back.
Maybe try unsharing and reshare your screen. I hate to break your flow, but then we're all looking at it, hoping to see an image of something.
Am I back?
I see you, and yep. So if you reshare your screen, hopefully we can get back to that slide.
Yeah, it just cut me out.
Oh.
What do you now?
It says you're starting to share your, oh, there we go. There's a picture. It's a
Okay.
little pixelated, but at least we have an image.
It'll come clearer. So back of the stifle.
I hate to interrupt your flow, but
Fibrotic myopathy occurs in the back of the stifle area. That's okay. Is it over now? No.
oh, oh dear. Oh, I hope we
Okay,
have.
are we good?
Yeah, we've got your slide. Oops, we lost. Uh-oh, we lost her altogether. Oh no. Hang on, folks. Hopefully she can get back in. Because it's really fascinating. And if anybody has any questions for Dr. Butler, you could pop them in the chat. She's back. Well, she's kind of back. Oh, make co-host again.
Is it working?
Yep, you're back.
I just tried to move my modem to see if that helps.
Oh, okay.
Okay, am I still sharing my screen?
No, you just need to reshare your screen.
Okay, sorry about that.
That's okay.
All right, can you see my screen now?
Yes.
Right. So hind end tears. I'll just start this bit again.
Yep. Take it from the top.
So around the hamstrings, around the tuber-ischium, that's a point of buttock. The junction of the biceps femoris and semitendinosus. So down the poverty line, it's an area where I feel a lot of restrictions. It'll feel like really ridgy through there, and that's going to restrict the hip motion. Fibrotic myopathy tends to occur down in this area, either the back of the stifle or where the tendons of like the semitendinosus, semimembranosus biceps come in. And so that once it's fibrotic, it's quite a challenge to repair because of the thickness of that dense, irregular collagen. The semimembranosus and semitendinosus, anywhere really through here, middle gluteal, especially middle gluteal tongue, adductor gracilis on the inner thigh, more probably up at the origins, gastrocnemius in here at the back of the stifle, the dorsal sacroiliac ligaments, the sacrotuberous ligament, as I mentioned earlier, and kind of next to the anus. And so there was a study where looked at 218 horses in all types of different sports, and they found that there were 25 that had muscle damage. They were lame. 8 horses had a history of falling. and 12 out of 24 had displacement of the tubercoxy. 6 out of 25, the muscle damage was a primary cause of lameness, with some others with fractures. Fibrotic myopathy commonly affected the semitendinosus, and 34 out of the 218 had damage in the gluteals and the hamstrings. So those areas are commonly under strain. I think saddle fit has a huge influence on dysfunction through the pelvis and the lumbar area, and then puts those muscles under more strain. So can you see my pictures?
Oh yeah. They're dissections, right? Yeah.
Sorry, it's a bit, yeah. So I always have dissections and I hope people aren't mortified, but that's the best way to kind of learn and really see the degree of the scarring. So this one had a fractured tubercoxy. So it's down, sitting down here instead of sitting normally like this. So it was displaced. And then this is the scar tissue that was in the hamstrings. This horse did have a lameness in the gait. So the biceps femoris had scarring, and then this is the sciatic nerve, which has also been affected by the damage through there as well. So you can see that there would have been pressure and discomfort through that whole area. So this was a tubercoxy fracture, affecting the hip and the sciatic and those muscles, biceps femoris. So when we talk about treatment options, initially when it happens, if you do know that it's happened, we want to ice it, and maybe heat. It depends, you know, sometimes if there's a lot of spasm, then heat can actually be more soothing than ice. So you need to kind of assess that situation. Whereas if there's a lot of heat in the area, then you would want to use ice. But if there's a lot of spasm, then you would probably want to use heat. Laser is really beneficial. Again, ASAP, like day one, if we can get it in there. Taping, different sorts of taping. It's going to depend on if it's chronic or acute. Mobilization. So there's actually been papers to show that we want to mobilize within, so we'll let the inflammation settle, and then by about day 3, we actually want to start doing mobilization, because muscle fibers muscle fibers align in the degree of muscle fibers align in the direction of movement. So you want to make sure that you're getting appropriate and correct movement in that area for what that muscle is going to do. So therefore, you want to start mobilizing it ASAP to actually stimulate those myofibroblasts, the muscle cells, to lay down in a parallel alignment with the muscle fibers, rather than it just haphazardly laying down stuff, which then becomes scar tissue to fill in the gap. Massage can be beneficial as well to stimulate the circulation, also prevent the buildup of scar tissue and help promote alignment too. Therapeutic ultrasound. Therapeutic ultrasound has also been shown to be beneficial, and walking, because again, walking is going to promote parallel alignment of the muscle fibers, and trying to get the most balanced, correct walk that we can. And then we will progress from there. So this is more in the acute stages. This picture here was a horse that had actually had a damage on a gate, so on a like a protruding thing in a gate, and the quarter shoulder ripped it open, and I saw it, I think it was a year later, or somewhere between 6 months to a year later. Chronically lame, obviously lame, like a grade 4 out of 5 lameness. So obvious lameness in all circumstances, very lame at the trot. A whole lot of scar tissue over the scapula, and I questioned whether it had fractured its scapula, which it may have. I worked on it over 3 treatments, and in the second treatment, I think I used taping. I didn't have laser at this point, so it was really a lot of my hands doing the work, myofascially breaking down the scar tissue. And this horse, the last time I saw it, the owners did a lot of work. They did all the exercises I asked them to do. And the last time I saw it, you couldn't see the lameness. So you can still treat them even if they've been there for 6 months, a year, 2 years, so long as it's not fibrotic. That's the challenge. The time frame that we're looking at is probably 6 to 12 months. We need to really think about the origins and insertions and skeletal function. And we want to limit immobilization. So we don't want to lock them up in confinement. However, they might have to be confined if they run around like idiots, but then they're still going to need to be exercised like regularly. Might be twice a day, 3 times a day, 5 times a day. We just limit that immobilization in the immobilization, only immobilize them in the inflammatory stage because you just want everything to settle down. And then sometimes surgery, however, it's not always common because muscles don't like to hold. There's not very good anchorage to stitch them back together. They do fill in pretty well if given the appropriate circumstances. However, sometimes we just have too big a deficit and the only way it can be filled is with scar tissue. And then as they get stronger, then we want to do body work, stretching and mobilization. We want to observe them, make sure that all this is actually management and prevention. So we want to do regular body work, stretching and mobilization, make sure that we observe our horses, and if we notice something's not quite right, we get onto it straight away, and making sure that your body worker kind of picks up things before they become a problem. We want horses to have maximal turnout. Their hoof and dental balance is going to be important for optimal muscle balance and function, as well as the saddle and bit. You can help your horse by being fit and not adding to the fatigue of being unbalanced, especially. Nutrition, so salt and magnesium are really important for muscle function. And re-injury can be common, especially because we often give up a little bit before the rehab is fully complete. And the other aspect, of course, because I was talking before about acute muscle tears, but as you progress in that recovery, then you're going to want to build strength. And I didn't really talk about building strength. And in building the strength, that's where the surefoot pads would come in. So you would utilize them to help build the strength in the muscles, build the postural strength to try to prevent it from reoccurring, and also help with the muscle function through the use of surefoot pads and progressing them depending on where it is, what the problem is. And I've certainly used those as well in muscle damage. I think we use them a fair bit with that grey horse. Mm-hmm. And that also in prevention comes into variation. So it comes into the variation in training with your different surfaces, which will obviously include surefoot pads as part of your training regime, your different feeding positions to promote postural stability and strength, ensuring that you do an adequate warm up and cool down, which is going to depend on your environment at the time. Fascial hydration breaks means that, and there's been studies to show these are beneficial in humans, basically means like if you just did, say, some gymnastics jumping, you do a big, nice stretchy trot afterwards and get up off their back and let that fascia rehydrate. It might also mean you get off the horse for 5 minutes and let them walk around. It might mean you do a few stretches in your, in the middle of your workout, for example, just to try to give that fascia some time to rehydrate and get back into a happy place. You also want to make sure your horses had sufficient recovery. So we've got to remember horses maintain fitness really, really well. They don't lose cardiovascular fitness for at least 6 weeks. And they won't lose appropriate strength if it's been posturally trained to kind of create an efficiency in that posture. Then they'll also maintain that very well. So making sure they have a sufficient recovery of at least 3 days after a hard competition. Recovery doesn't always mean turning them out. Recovery could mean taking them for a walk in hand. It could mean doing some mobilization exercises on the ground. It could mean having a massage or some body work. So it doesn't mean just don't touch them for 3 days. Tapering your training before a competition to try to prevent fatigue from the competition. And so you might taper depending on the level of competition. Like in endurance, they kind of recommend tapering at least a week out, a week to 2 weeks out, depending on what level you're looking at. So tapering means, you're not training hard up to the day before the competition. You're not going to improve anything at that point. You're just going to create fatigue. Okay, so these are a couple of cases. So the one on the left, you can see a significant dent just below the tuber ischii in the hamstring muscle. And now that's going to probably be a bit of an ongoing problem. However, you should be able to kind of work that to optimize the motion and soften it. So you always want to be working, if it has scarred, then you always want to be working the scars to just try to keep them as mobile as possible, even though you're not going to fill them in with muscle tissue at that point, but keeping them soft, keeping them supple, keeping the pelvis moving optimally, keeping the origin insertions of the hamstrings happy, keeping everything around it happy is going to prevent that from further injuring itself. The horse on the right, so you can see we've got a scar in his upper forelimb. This is an equine student and he was lame. She took him to the vets. They couldn't find anything. She was the one who picked this up. And yeah, it became a scar, but through treatment, you can hardly see it now. And she just knows to maintain it and check it after every ride. He's eventing. But it was an injury and he was lame and the vets couldn't figure out why he was lame. And, you've got to really be feeling everywhere to pick up an injury like that. So you can't block it. It's a really difficult area to diagnose if you're not looking there. This horse was obviously a traumatic injury that went down to the tendon. It's come up, yeah.
Yep.
So it went down to the tendon and it took a couple of months to fully heal, but he did re-injure it in that time a couple of times, just running around in the paddock. But what you'll notice is that that's not a scar. It's beautiful skin over the leg, and that laser and taping were used throughout this horse's healing process. And I think, yeah, by the end, there was nothing. You couldn't tell there was an injury there. And these are the type of injuries that can become chronic scars that can lock down extensor tendons and have a kind of ongoing, create an ongoing issue with the biomechanics of the limb. And you've also got to be careful with these sorts of injuries that they haven't also sustained upper limb injury. So sacroiliac, for example. This horse had his injury for over a year. He'd had the scar for over a year. What happened was he had a very bad injury down to the bone. He was told that the owner was told you should put him down. She treated him for 6 months. The only thing that maybe contributed to a breakdown was he was locked up for that whole time because it was so extensive. And then when she let him out, it broke down. And then she had another 6 months of bandaging for that to heal again. And when I went to see him, he wanted to kick my head off if I touched that area. It was very, very painful. Scar, I guess the one thing I didn't say is that in areas of scar tissue, you can get an increase in sensory nerve fibers. And so scar tissue can become very, very painful. And I have a scar on my leg from surgery last year, and like that at times it pulls and it's uncomfortable and it's painful. Since I've kind of been working it more, you know, it's going away. So he was very painful. The leg was quite pale looking. It was quite swollen still. You can see the swelling through the leg, and it's hard to appreciate, but it was pale, and the swelling through the hock and just the general thickening. I use taping and manual kind of myofascial type work, scar release stuff. And by the April, and he wasn't having pretty normal size. The scar was pretty insignificant. It was pain-free. So that was the main thing, that he was comfortable on it. And this is that caught up?
Not yet.
Just tell me when.
There we go.
Okay, so this is just looking at his whole body. So up the top, that's when I started treating him, and that was just I think a couple of treatments between those. But you can see, like, we changed the shape of his whole body, because I didn't just treat the scar. I treated, like, and we got him kind of, he had other chronic issues. He'd flipped over a gate. It wasn't just this scar that he had going on in his body. But we did improve him significantly over a few treatments. But the main thing is that the leg with the scar improved the most. This is a pectoral tear, the ascending pectoral insertion into the sternum here. So she's a competitive horse, and there's a big scar in there that I can't break up, but I can tell when the owner has been regularly massaging it or not. So it keeps the area supple and happy. And yeah, she dobs him in if he hasn't been doing his work. This horse here is my old horse. You can see there's an extensive pec damage and through the shoulder there as well. I suspect this is influencing his CT junction. He used to buckle at his knee, and using variable feeding positions, we completely stopped that from happening. But yeah, he has chronic, like, I did try to bring him back into work, and he was chronically lame with that injury. So he's just retired in the paddock now, but it's very extensive. And I suspect, well, he did it in racing because he was racing and winning, and then there's a stop in his career and he never came back the same, and he windsucks, which is probably due to the pain. Now just tell me when that's caught up.
Yep.
So I'll just go through this image here on the right first. This horse I've known for a long time. You can see her damage in her hamstring here. It was so deep. It is so deep. Eventually, she doesn't help herself. She runs around and she loves doing sliding stops. It's her favorite thing to do, to run flat out, especially after a treatment, flat out, and then like just sliding stop into the gate. So she's definitely torn that many, many times. Now I think it has ended up in an injury in her hip, and I suspect she's ruptured the ligament in her hip. Ooh. We just keep her comfortable and sound, or not sound. We keep her comfortable, and we treat her. Her owner's a physio. She gets treated all the time. But it's an example where she was never able to be ridden again because of that issue, and how it's then led to other issues due to the restrictions through her pelvis and her lumbar, and then how that hip has become damaged. So we've got some holes in here, down through the junction of the biceps and semitendinosus. Got a lot of ridge and ropiness, especially through here. And then in here we've got a large hole. You can feel the edge of that fascial. So I'm privileged to own a few horses with muscle tears. Actually, all of them. and I'm sure you all do too, I'm sorry to say. But he has fascial tears, muscle tears, and yeah, he's a bit of a mess from his racing days. Oops, sorry. So we've got some holes in here, down through the junction of the biceps and semitendinosus. Got a lot of ridge and ropiness, especially through here. And then in here we've got a large hole. You can feel the edge of that fascial tear through there. Okay, and there's a reference list there for anyone who's interested in some papers on muscle tears, and acknowledgements to Sharon May Davis for teaching me dissections, Teresa Hendricks and Equine Studies of the Netherlands for some of the photos and their knowledge as well. So awesome. Thank you. And if you have any questions.
We do. And, I had the privilege of being with Sharon at a dissection a year ago, February, and the horse had an injury below her ischial tuberosity, and then we dissected out the scar, and it was so thick and went so deep.
Yeah.
So from my own personal experience, when the horse flipped on top of me and broke my hip socket and they screwed it back together, my brain always said, oh, it's like a Band-Aid. The scar is like a Band-Aid on the surface. And then one day a friend of mine pointed out, she says, no, it goes all the way to the bone, to the hip socket. And it was like, oh, that's why my leg is restricted.
Yeah.
But it's hard to think on that 3D level of the depth to which these superficial feelings are going, right? Sometimes it's really hard to understand that. And it's really hard to know how deep that they go, because you really can't feel like and palpate into those depths. And what I think surprises all of us that do dissections is especially in the hind end, how deep that scarring goes. Like in the front end, a lot of the time you can palpate the depth, because the muscles are, there's just not so much muscle bulk unless it's under the scapula. I have had a horse last year that had a horrendous arthritis in the elbow and had torn off one of the attachments of the serratus to the scapula. So that was under the scapula. Ow. Yeah.
So if something is under the scapula, then we're going to have a hard time diagnosing that and the depth in the hind end.
Yeah. So somebody's asking, do superficial scars like brands affect deeper muscles and horse movement?
It's a good question. I don't think so a lot of the times, but I think because often the brands are done and then the horse is out moving, and it should just really be affecting the skin. But I guess there could be brands that are become deeper, like they've been held on for longer or whatever, and perhaps they've caused more damage to the deeper skin layers, which have then affected the fascia. But I think you would be able to feel that. So I know I have heard of people saying some horses have had scarring around their brand. So I think it's always worth having a feel and a check and seeing, does it feel smooth and kind of supple, or does it feel like it's adhered and roughened? Then you should be able to work on that quite easily, I think, because it's probably quite superficial scarring, not deep into the muscle.
Okay. Barbara's asking, my horse developed a significant infection associated with a puncture wound. It required 2 drains and left her with an indentation scar in her flank. Do you have a recommendation for management? The injury occurred 2 years ago.
Yeah, I mean, with the drains, it just depends on the level of scarring around them, but finding someone who can either manually release the scars and feel that for the depths, or finding someone with laser or maybe PMF or probably those or therapeutic ultrasound. So just to try to like break down some of that scar tissue, because I have had horses where there was one horse that I was treating who had a significant scar in his flank that was affecting like his affecting his whole body. It wasn't from an infection, it was from an injury. But a couple of treatments and that for him kind of settled that area down. So to see if you can find someone, even 2 years later, it's still worth getting it worked on, because it will be restricting, like if there's scar tissue in there, it's going to restrict the movement and the hind end motion, ability to move. It could even be like influencing the diaphragm. So yes, it's still worth getting that, finding someone to work on that. Yeah. Or even just starting some gentle massage yourself.
Yeah. You know, with people, we have different, like we get keloid scars versus nice. Do horses get different types of scars like that? Do they get keloided scars?
I haven't officially kind of read about it in any study. I think nutritionally and breed wise, that there probably is a propensity to have different types of scarring in different horses, because I mean, you're just feeling them. Some horses, like different breeds, can feel very different in their kind of collagen kind of feel, like their fascial feel. So yeah, I think that they're, especially nutritionally, I think that could have a big influence on the type of scarring. I don't know if specifically they get keloid scars. However, sometimes you will get those horses on their limbs where they'll get those big lumpy raised scars. And is that a management issue, or is that, you know, something kind of related to that individual horse?
Right. Going back to humans again, for me, when I've had surgery more recently, not in the past, they've given me, there's a product called Scar Gel, and it's got silicone in it. You can either get like tapes that you can put on with silicone, or the gel material, and it really reduces the scars. You know, these are like new scars, right? But actually they talk about old scars. But we don't have anything like that for horses, do we?
No, not that I'm aware of, but I think the important point of that is that so as something is healing, not just letting it dry out. So actually protecting it. And that's where, you know, there's different opinions around bandaging and not bandaging limb wounds, for example. They'll all heal whether they're bandaged or not. But if you want to prevent scarring, then keeping it kind of in a more moist environment, using things like vitamin A and vitamin E, lanolin, rosehip oil, like things that are going to keep that soft as it's healing. Because as soon as it dries out, it cracks, and then you get more scar tissue occurring.
Right. So one more question. I've read in, I'm just going back to human because having had many scars.
Yeah.
I know that when they talk about static stretching, they talk about that you can cause little micro tears in the muscle, which then becomes scars. So that's a whole different, that's not an injury scar. Well, it is an injury, but it's tiny little scarring in the muscles. Do we have to worry about that same thing with horses?
Yes, I believe so. And I think that comes back to when I talked about like prevention and management in terms of appropriate warm up, cool down, incorporating mobilization exercises in your routine, and not working into fatigue, which I think we do a lot without recognizing that we're in fatigue. So yes, I think we do get a lot of micro tears occurring in horses, especially tendons, especially at origins of the flexors, in theses areas of those attachment sites to bone, like the tendons, ligaments, muscles, attachment sites. So yes, I think it is a problem. In terms of stretching, static stretching is not ideal unless you've worked up to that over a period of months and you've got an aim of lengthening. But a lot of the time we tend to, you know, the studies are showing now, even in humans, that 15 seconds, so I think, what do they say, 20 seconds times 3, no more than 90 seconds altogether is enough, and anything over that is not benefiting in humans. And in horses, like they talk a lot more now about dynamic mobilizations rather than static stretching, because I see a lot of people like they stretch to the resistance and then they hold it at the resistance. But what we need to do is feel the resistance and back off so that the muscle fibers can actually respond. Otherwise, they just kind of go into a bit of a brace, and then you're not really creating the benefit that you want. And the other thing is, if you go too far and then they push their leg down, that's a great way to cause tears and micro tears up in the origin, like an uncontrolled stretch where they kind of push their leg, whether it's for their hind leg or forelimb. They're saying, you've gone too far, I can't hold it there. And that's all they can do is just kind of slam their leg down. So always back off your stretch and keep it more dynamic. So not holding for more than like 15 seconds.
Good to know. Good to know. All right. Let's see if anybody else, there might be another question. Oh, she just said, thanks a lot. Well, this has been great and really helpful. If anybody else has any more questions, just pop them in and we'll ask Dr. Butler. Like I said, I personally have a lot of experience with scars, and
Me too.
when I had the second surgery, because I built a bone spur, and I asked him to clean up the scar because he went in, and boy, did that really help. It was such a deep scar. It wasn't going to totally resolve on its own, and that really made a difference.
Yeah, and that's something like we probably don't do that in animals, but perhaps especially with maybe even the area that she was talking about on the flank, like in those types of areas, that could be an option. But it just depends. You've then got to keep it moving and prevent it from reoccurring as well. So you've still got to kind of prevent it. But yeah, sometimes the scar tissue, if we could remove it, could be beneficial in some instances.
Right.
Just depends where it is.
Well, Dr. Miller, it's so great to see you again. I'm sorry it's taken us so long to get back, but I'm so happy to see you. Somebody's asking, is there a preferred way to clean up scar areas? I have an old psoas injury.
Oh, well, the psoas is pretty deep, so that's quite a challenge. It's even a challenge to kind of treat. I mean, something that kind of gets in some kind of vibrational therapy that maybe gets in deeper to that area, like your PMF or your therapeutic ultrasound, maybe even laser might get into the depths, but you need something that's going to get into the depths. And I guess a good osteo may help you to kind of get in there. It'd be very painful, but they might help you to kind of get in there and break some of that up. Physios love doing that. I hate it. I think you can deal with scar tissue in different ways. It doesn't all have to be like physical breaking up of adhesions. However, sometimes that's probably required.
Yeah. All right. Well, thanks so much. And thanks everybody for joining us. And just remember, you can find this and all the other webinars on the Surefoot Equine YouTube channel. Have a fabulous afternoon. And thanks again, Dr. Butler. So great to see you.
Thanks so much, Wendy. Yeah, great to see you.
Take care. Bye.
Okay. See ya. Bye.